name is Bill Hall. I am a radiation oncologist at the Medical College of Wisconsin, and I'm one of the co-principal investigators of GU012, the SAMURAI study. So the SAMURAI study is a randomized clinical trial for patients who present with metastatic kidney cancer that has spread from their kidney to other parts of the body. It randomly assigns patients to receive radiation therapy to the primary tumor in their kidney combined with immunotherapy or immunotherapy alone. And patients are favored 2-to-1 to receive radiation therapy to the primary tumor in the kidney, which means they have a slightly higher chance of receiving the experimental arm, which in this case is radiation therapy to the tumor in the kidney along with immunotherapy, as opposed to immunotherapy alone, which is the current standard of care. I would say the most common questions we receive are who are the ideal patients to enroll into this trial? And the patients that this trial is really designed for are patients that do not have small volume, or what we refer to in the cancer community as oligometastatic cancer. This is for patients that have multiple sites of cancer that is spread throughout their body from their kidney. And this is also for patients that may not or would rather not undergo surgery up front for their kidney tumor. In other words, some patients are recommended to have surgical removal of the kidney tumor when they're diagnosed with metastatic cancer. This trial is for patients who would rather not undergo surgery, or for patients for whom the cancer team treating them recommends them not to have surgery up front and instead start immunotherapy. I think it's important for sites to know that this is a very innovative trial in the sense that it's one of the first studies through the NCTN to address the question of radiation therapy treating the primary tumor in patients with metastatic kidney cancer. So for sites that are interested in starting a renal or kidney SBRT radiation therapy program, this study might be a very nice option for them to do that in the setting of a clinical trial. I also think it's important for sites to know that patients have really driven the design of this clinical trial. And many patients prefer a less invasive, non-surgical option to manage the primary tumor when they're diagnosed with metastatic disease. And so for patients that are less than ideal candidates for upfront surgical resection, or for patients that prefer a less invasive treatment option, such as radiation therapy, the study is a really great option for those patients.